All right, this is Implementing Nurse-Led Discharge Education to Reduce Readmissions by Robert Johnson. So I am a nursing student at the University of Southern Mississippi, and I am presenting a planned change to improve the healthcare system by implementing structured nurse-led discharge education to reduce hospital readmission. This change is based on my clinical experience that I've gained at Forest General recently and at Wesley at previous clinicals and this summer. And this mainly pertains to medication compliance, wound care, and the attendance of follow-up appointments. And those three things are very important, and I think a lot of times education is kind of glossed over. So the rationale for change, according to the Agency for Health Research and Quality, nearly 1 in 5 patients experience complications or readmissions within 30 days of discharge. Many of these cases are linked to poor communication and inadequate patient education. Nurses are they're on the front lines for all patient interaction and everything that goes on within the care setting, and so that should empower the nurse to provide a standardized, patient-centered discharge, teaching significantly improved outcomes can be attained by adhering to a standardized and more, I don't want to say legalistic, but a more structured and just a standardized version of discharge teaching. And here we go. So the change theory I would use is Lewin's change theory, which includes 3 stages: unfreezing, changing, and refreezing. In the unfreezing stage, we have to identify the issue, which is high readmission. And we have to engage nursing staff and leadership with data, just some hard evidence showing the impact that it has on the patients, of course, but also on the hospital's bottom line, as this is a business and we don't want to just be hemorrhaging money. So then during the changing phase, we have to implement a standardized discharge checklist and provide staff training for the discharge. It wouldn't be very difficult. This is stuff that we have already learned in nursing school, and I think a lot of times it's things that people forget as they start practicing. So finally, during the refreezing, we would monitor readmission data and reinforce success through staff feedback and recognition. That's pretty self-explanatory. So just like anything, there are barriers and solutions. The main barriers would be time constraints, staff resistance, and inconsistent communication between nurses and physicians. To overcome these, we have to integrate education sessions into existing discharge workflows. We have to involve nurse leaders, or we have to encourage nurses to lead by example. And then we have to present everyone with data showing that improved discharge education will reduce nurse workload, and over time it'll prevent avoidable readmissions. So the feasibility of implementation could start as soon as you have the means to begin a pilot program on the discharge or on the hospital unit. Each nurse would need to complete training, and that would take about 3 months to get everyone through it and to have some data via survey or some readmission rates that aren't kind of skewed to go off of. So in conclusion, implementing nurse-led discharge education through Lewin's change theory could reduce preventable readmissions, improve patient outcomes, and enhance nursing professionalism. This initiative reflects the values of evidence-based practice, advocacy, and leadership central to the ANA Code of Ethics. Thank you for your time.